My name is Paul Fugazzotto. I'm a periodontist for the last 34 years in Milton, Massachusetts. I attended New York University for my dental degree, Boston University for my certificate in periodontology. The ITI is very simply the finest organization in dentistry for a number of reasons. It is research-based. It then takes these research findings and gives you clinical guidelines to help yourself and to help patients. It is truly dedicated to education on all levels, not just big fancy world symposia and congresses, but the grassroots level. It is dedicated to helping all levels of dentists, newbies, people who are lost, honestly, in the woods, people who are sophisticated, people who are highly sophisticated. It's there for everybody. It's simply the best organization there is. It has a unique blend of education and camaraderie. Well, the ITI works on so many levels. We have consensus conferences, which I've been privileged enough to be in, where we really try and distill the information, separate the wheat from the chaff, and figure out what's happening and give recommendations. Then the ITI, of course, has the world meetings, and then the local meetings, and then the grassroots meetings. The ITI is education and research first, and everything else second, and that's what it should be. It means to be, and it is, a guiding light, not necessarily for the best person in the world, they're going to figure it out, but for everybody else, and that's what we need. Why is it important to use the Straumann products with Straumann implants? Because you get a better result, because you have less chance of complications, because you don't have the cataclysmic outcomes of failure which impact the patient on many levels, psychological, financial, and therapeutic and physical, which impact the clinician on many levels. Psychological because of the disappointment in your failure. Financial, obviously, and therapeutic, and which just impact everybody in another way. The patient wonders if you really are the person to go to, did you do the right thing? You live with the fact that you tried to cut a corner, and as a result, somebody who trusted you failed. It's not what I want to do. I saw a patient last week with a fractured non-Straumann screw in an implant. In the last year, I have seen 6 fractured screws in 5 patients which were non-Straumann screws. To put this in perspective, in the 20-plus years of using Straumann and Straumann components, we had 1 fracture well over a decade ago. This was in a faulty manufacturing lot. Straumann caught it right away and recalled it. I happened to have put 1 in before they recalled it, and the screw fractured. These are 6 screws in a year. What is the impact on patients? The impact on the patient is they're disappointed, they're upset. One of the patients actually said, is it something I did? They have guilt. They have a physical impact. We've got to redo everything. There's no financial impact for them because, of course, you do it for nothing. The impact on the dentist is on many levels. The obvious one is financial because you're redoing it for nothing. The less than obvious one is damaging the bond between yourself and the patient. And if you're a specialist, you may be damaging the bond between yourself and your referring doctor. Then you've got the other problem, again, having to live with something you didn't expect. The problem is that you don't always know it's happening. 4 of these screws I've encountered, the laboratory didn't tell the dentist that they were doing this, and they have to live with it now. The steps you take begin long before that. They begin by putting together a team where you work toward the same goal in a concerted manner, where you can count on each other and know what each other are doing. Then you make mutual decisions about how to proceed. None of the dentists I work with regularly will even consider using a non-Straumann part because they know it's a potential compromise. So how do you ensure it? You work with people who understand the difference. And you talk together, and you make your protocols together, and your treatments together. And that's what you do. The people I worked with the problems I mentioned to you, 4 of them didn't even know that the laboratory used a non-Straumann part. The other person, I had just begun to work with her, and she used these 2 screws in 1 patient. They both fractured because the laboratory told her they were cheaper and just as good. What is the difference? The difference is you have a team working together all the time. I'm from Boston. Who's the greatest basketball player of all time? It's not Michael Jordan. He's the greatest individual of all time. The greatest is Bill Russell because everybody won a championship. In our team, whether it's me or the restorative dentist I work with or the patient or the laboratory, everybody wins the championship because that's the way we play. The first thing is the definition of success in this discussion we're about to have. And success doesn't mean an implant has stayed in somebody's mouth. It means it's healthy and not just surviving. Now, if you take a practice that puts in 500 implants a year, which is something I don't understand, honestly, because if you put in 100 or 200, you're just learning to do this. If you put in 900 or 1,000, you've got things working well. If you put in 500, you're working with dentists who understand, but you're not maximizing the potential to help patients. But let's say you only do 500. You should have less than a 1% failure rate with a Straumann implant properly utilized in a proper way, in a proper case. So that means that out of those 500, give me a 1% failure rate, I'm going to have how many? I'm going to have 5, right? Let's assume that I can get this discount implant for $125 less than a Straumann. Now you take those failures and take the time for them. Assume the average fee in the country, which is about $2,300 per implant. Take these 25 failures. You waste an average of 1 hour and 50 minutes on each failure. You book an hour for the surgery. Now it's failed. You've got to have at least 20 minutes to talk to the patient about why it failed. You've got to redo the implant, that's another hour. Then you've got 3 follow-up visits, hour and 50 minutes. Multiply that by $2,300 an hour, and that comes out with a loss of $15,000 a year or more, sometimes up to $30,000 a year, over what you supposedly saved by placing this cheaper implant. And that's the immediate loss. Now you're the specialist who placed this implant, you lose the patient confidence, and you may lose the referring dentist. Or you're a dentist who places their own implants, you lose the patient confidence, and you may face a lawsuit because you're not quite as, quote, experienced, and the patient's mad. It makes no sense. No sense at all. You save money doing the best thing you can in the long term. I place the implant, so that's pretty easy. They come in a Straumann box. But you get labels with all the parts to know it's an original Straumann component. That's an important question because some of these laboratories do a bait and switch. They send you an envelope, and it says in small letters, compatible with, and then in large letters it says Straumann implants. So if you don't read the envelope well, you actually think you got a Straumann part, which is truly bait and switch. They say, oh, it's just the way the packaging is. No, it's not. The way you know is, of course, A, again, working with people you trust, you know what they're doing, or B, you look at the packaging that comes with it and the labels. The best way to sum up this discussion is to remember one overarching fact when we practice clinical dentistry. Every day, an amazing thing happens to you. An amazing thing. A human being comes to you and they give you their body and they say, can you help me? And when somebody does that, the least you can do is the best you can do. Because that defines you as a clinician and as a human being.